Nobody wants to grow older gracefully. You never know when something's going to happen. Thank you. Okay, I forgot about that one aspect. I muted myself, but you can't mute the volume on your own computer like that. Okay, perfect. So the importance of planning ahead is like what was said, you don't know what's going to happen. You all have a certain image, or we all have a certain image of ourselves as we get older, right? Yet the thing is that most of us don't quite end up exactly how we think, because I don't know about you, but I'm never going to use a walker and I'm never going to be in a wheelchair. And yet, as you'll hear earlier or later in the program, about 67% of us will need some sort of help after the age of 65. And I already have a bad hip. So the idea, I'm just talking about mobility, and that's only one part of it. You're absolutely right. So these conversations are about where you want to live, how you want to live, what's important to you. Is family the most important thing? So being close to your children, or for the children out in the audience, having your parents nearby you? Is it the community that you've lived in and in some ways grown up in? I didn't move to DC until I was 22. I've been there since. So now I've lived here longer than any other place. And I was born in Washington State. So I thought I was from Washington State for the longest time. Also, end of life. You know, how do you want to live at the end of your life? Part of it is building up that support system. For example, I worked with a woman who worked in senior living. She and her husband had traveled the globe. They had family out west. They never had any children. And yet one of the most important things to them, and what she saw in the community that she worked in, was the people who were most successful were the people who had supports around them. And so she made the decision, I think it was in her mid-50s, that they were just going to move closer to the West Coast, because they knew that their niece, who was the most important thing to them, she was never going to move to the East Coast. That was out of the question. Now, she might not have stayed in Arizona, but she was definitely going to be in the West. So they've now been out there for about 20 years or so. And she's had that time. They've built up the support system. They've gotten to know that community. So that's planning really far in advance. But these are the conversations we should be having. The other most important part is really being flexible, because you can make all the plans that you want, and yet then something will happen that was completely unexpected. Like I've already told you, I have a bad hip, so I'm expecting to have hip surgery, but what happens if it's really my back that goes out and I'm not planning on that? And again, just talking about the physical, not the rest of it. As you can imagine, when and why do older adults and their families seek help? It's often when there's a change. Again, that need, that thing that happens to you tends to be the driving factor, whether it's a fall that's put somebody into the hospital, they can no longer function in the same way they used to be able to. Perhaps it's a chronic condition that has really just deteriorated to the point where it's reached a crisis, or maybe they can't manage it on their own. What I frequently see people have most difficulty with is managing medications, for example. Which is where most people want to stay, is to stay in the home that they've lived in for as long as possible. But of course, as long as possible is relative, right? But that medication management is often the thing that pushes people over the edge. Frequently, following the death of a spouse or a partner, or perhaps a caregiver, unfortunately, one of the things we see quite frequently is that caregivers seem to pass away before the person they're caring for. Again, it's because of the self-care aspect, not taking care of themselves or addressing their needs. And then, of course, when the children come into town, for those people whose children no longer live in the area, it used to be pre-pandemic that we would get a lot of calls after Thanksgiving and after Christmas. And the reason was, or after the holidays, because people would come home. And you see a lot more differences when you don't see somebody on a day-to-day basis. When you see somebody every day, you don't see the small changes that happen. So then when you come into town and suddenly mom is not doing all the same things that she used to do, or dad is not visiting, going out with his friends the way he used to, or taking care of the yard the way that he used to, it suddenly hits you all right there in your face. So that typically is when we see people calling. Yes. Hmm.
I can't hear. Cannot hear now.
Okay, I'll repeat it in just a moment. Yep. Yep. Yeah, that's okay. So let me just repeat that for those folks who are online. So his mother independently made the decision to move into a senior community that was both independent living as well as assisted living. And then she came to the children to have that ratified. And as she spoke, so it, in that way, actually, she involved everybody, right? She made the decision herself. She made it ahead of time. And then she also got her children involved, which is wonderful. So hats off to your mother. And he said that what she heard in the community was people felt like they had been forced into the community against their will. And you didn't say the second. Oh, the loss of the car. Yep. So that's a big thing. And that was one of the things that I was also going to talk about. So those, that is a story that we'd like to hear a lot more often. But usually we don't hear that because people aren't sure when that tipping point is. And that's when it's always a good time to kind of talk with a professional to understand what your situation is or what your parent's situation is, so that they can help you gauge a little better about where that tipping point might be. With regards to planning, I'm sure many of you have met, or some of you may have met with a financial planner, and they talk to you about what do you want your life to look like. I would say that anybody who's 18 and older should start planning. Should you be planning to move into a senior community when you're 18? No. But you should be looking forward for the financial aspect, for the legal aspect of it, for the health aspect of it. And you should look, they say every 10 years, you should look at your documents, your powers of attorney and your advance directives. Take a look at your will, say, okay, is this where I need to be? What's changed in my life in the last 10 years? How do I move forward from here? And certainly as you approach retirement and then get into retirement, looking a little bit more frequently, because now that flexible time that we were talking about earlier starts coming into play. You start to recognize, oh, this is how I'm going to be aging. Okay, so some statistics. Suzanne asked me to share a little bit of statistics, so I wanted to get some of those out there about, well, why should I bother doing this? Because I'm going to be fine. So about 88%, I said that it was really high, and it is. About 88% of older adults want to age in place, but only about 45% of those people have made changes to their home. So the house itself doesn't have features yet that it might need. For example, my parents, I could see in their house, they had a lovely family room, a lovely living room. The family room was, of course, our storage room, a formal dining room and a breakfast nook with the kitchen, but there's only a powder room on that floor. And I kept saying to them and saying to myself, I wish you had the money to make this into a large bathroom because you're going to need it one day. And you know what? My dad passed away in that family room. So it's one of the, and I don't tell you that to get sympathy. I'm just saying it happens, and it happens faster than you think. 67% said they had someone to provide personal care. And about many of those people had someone living with them. So my assumption is that many of those people who have someone to take care of them and provide personal care, that's either a child they're living with or perhaps a spouse or a partner. So what happens if that child can no longer stay there, or perhaps they pass away before you? What happens if that partner or that spouse passes away? 70% of those turning 65 have a chance of needing some sort of assistance. Again, with this is things like bathing, dressing, cooking, cleaning, grocery shopping, transportation needs. Of those, about 69% will need at least 3 years of that care. So it's also the financial aspect, or knowing what programs might be out there and what your support system can help provide. By 2030, it's predicted that about 60% of older adults will have some sort of chronic condition. And again, those chronic conditions are one of the avenues that I see people coming to us. 1 in 4 older adults fall every year, and this is the greatest cause of fatal and non-fatal injuries among older adults. Again, people losing their balance, losing their flexibility. So it's all aspects of planning. Hearing and vision changes. So this actually impacts the driving as well. As we get older, our peripheral vision tends to come in. We have a harder time judging the speed of cars if we're trying to make a left turn. So those things, although they're impacting less individuals, they might have a bigger impact on us. Only about 16% indicated an issue with hearing and 7% with an issue with vision. Okay. Any questions or comments? Yes, sir.
Still on the, oh, sure. We're now entering the 4th year of this pandemic, and I'm just wondering how much that's changed your job and perspective, and how many more people are way more vulnerable, either because they had COVID or their health's going downhill or their resources are less. Any of those things you might comment on?
Yeah, so I had mentioned that pre-pandemic, excuse me, I'm keeping my timer on here so that I don't get you guys late. I had mentioned that pre-pandemic, we tended to see people after Thanksgiving and after Christmas, maybe at the end of the summer, there might be time. Now it's fair game, anytime. Yeah, people call all the time. Again, part of it is, as you've said, we haven't been able to see our family members. We still have concerns about traveling. Our family members have concerns about being out there. We still wear our masks whenever we see our clients. You see, I'm in my mask, but when I'm not talking, just because we work with a vulnerable population. So we are seeing quite a bit. And when people come, they tend to be in more crisis than they were previously. Yes, ma'am. And for instance, there were actually some very good things that developed in the pandemic. One, health maps, and people would volunteer, and it was mainly through next door, and you could have people in the person with that. And that was all free and available, but it was dependent on your IT access. And a lot of particularly older Americans who do have computers or cell phones don't have support for it. Yep. And so I think that it's cause of its own form of isolation. Yep. Yeah, you are right. Especially, I would say in this area, we've actually been very blessed with how many different types of aging services are out there in the provider network. So there are groups like Tech Moxie who will come in and help people with their IT to get things set up. But again, you know, there are some people of every age who really get and understand how to use the computer, and others who either don't have interest or that's just not where they're savvy. And again, that's not because older adults can't learn, because I have many a client who has now become very proficient at things like Uber, which helps part of that transportation issue. Others who now do Zoom all the time. My mom, it took her like 3 years, but now she's doing her exercise program with one of our life enrichment specialists, who actually her main job is providing exercise classes separate from care management. So she watches Regine every Tuesday and does her yoga with her, but she lives down in York County, Virginia. So yes, that is a big issue. But I will say that it also helped us during the pandemic to gather up those resources. People were available to do that volunteer work as well, which was really nice. Now we all have to go back to work because there was a lot of people that were my age or younger who were doing some of that volunteer work. Not totally, but many of them I know. I had friends saying, oh, well, now I can do this, which I really wanted to do. So within care management, what we do is we develop a relationship, and this is with our ongoing clients. We develop a relationship with our clients and their families. We get to know who they are, not just what their needs are, what their concerns and issues are, but what makes them happy, what gives them joy, what brings them that quality of life. And that's that assessment piece as we're building that relationship. Then we take our knowledge of what's out there in the community and try to meld that together to help work toward their goals. Are we always successful in working towards somebody's goals? I would say yes, we're always successful. But somebody might come to me and say, I want to age in place. This is where I want to stay. And I know just from seeing all of this that if I can keep them for a year in their own home, that's great. that will be success. So it's just moving them toward that goal. There's other people who have the financial capability and they've set up their home and they can stay there. And that is also wonderful. So it's also coordinating those services across the continuum. So not just in, yes.
So the question, can you all hear me on this mic? The question is the logistics of how care management gets set up. But I would say if we can answer that question and then let Christine get through the meat of her presentation, if we could just hold for 10 minutes with more questions, that would be super. So we can make sure we cover all we need to cover. So if you can answer that one.
Sure. Yeah. So somebody would call our intake line, which I have in the back there. It's our 0020 line where we talk through the situation with the caller. If there's someone who they really don't need care management or they're not ready for care management yet, which a lot of people are, it is a fee for service. So a lot of people will call us up and say, not quite ready for it yet. So we do try to provide some connections and contacts. When a person decides that they're ready for care management, then that's part of my role is to assign a care manager to work with them. It usually starts out with some intensive visits up front, just getting to know their situation, what are their health needs, what is having an idea of the financial situation, getting an idea of what the supports are that are around them. And then putting things into place. Now, in reality, I said people call during a crisis. So we're usually doing all of this at once. There are usually things that need to happen immediately. Somebody's discharging from the hospital in a week. They need to go home. They don't want to go to rehab. Or maybe part of it is saying to them, these are the benefits of rehab. This is where you could get good rehab. But if the person ultimately decides to go home, well, what do they need in the home? There's a role for the hospital social worker, but then our role is to work with the hospital social worker and then make it happen once they get into the home or when they get into rehab. Because some of it too is that advocacy piece with both in the hospital, with the individual getting the right information from the physicians, the nurses, the caregivers, the social worker sometimes who's completely bogged down with other patients, and then getting the older adult to wherever they need to be. And then hopefully once things stabilize, we can have more of a monthly visit, checking on services. Again, it really depends upon what our role is with the client. For some people, we do quite a lot where we may be the boots on the ground because maybe there isn't any other support. Maybe they didn't have children. Maybe they never married. Maybe their children live in California. I can't tell you how many people's children live in California right now. Although I heard during the pandemic that they were all moving out here looking for cheaper property. But maybe we are that person for them at the moment, or maybe we work in tandem with the caregiver who's here, the child who's here, but in the middle of their own situation, raising kids, having a full-time job. So the Aging Life Care Association, or ALCA, all of us at Seabury within as care managers, excuse me, are members of the Aging Life Care Association. That's the national association. And one of the things that I found useful for a talk like this was using the 8 areas of knowledge of a care manager. And they're here, but I wanted to go in depth just a little bit, knowing that I'm running out of time here. The first piece that I wanted to talk about is the health and disability piece. So navigating that system, I already spoke a little bit about this, but when someone goes into the hospital, or when somebody's just trying to figure out their insurance, they might turn to a care manager to help them with some of those calls. For somebody who's going to their medical appointments, maybe ourselves or our life enrichment specialist can go and take notes to report back. As the care manager, I wouldn't just take the notes, I'd be also brainstorming with the older adult or their family to say, okay, these are the questions that I hear you saying you want to ask. Here are some of the questions from my perspective that I think we need to ask about. Finding a provider. One of the biggest issues we have are psychiatrists who take Medicare and therapists who will go into the home and who will take Medicare. Fortunately, that's one of the positives of the IT during the pandemic is that there are a lot more telehealth people out there. Just navigating those changes in cognitive status. Again, not everyone has some sort of cognitive issue, whether it's just a slowing down of processing things. I mean, right now I can tell you most of us are suffering from pandemic dementia. I went into the pandemic in baby dementia, and now I'm just never going to be done with it. So navigating those changes, is this really dementia, or is this something acute that really can be changed? For example, people who have a urinary tract infection sometimes appear as though they've lost cognition. And as soon as they start getting the antibiotics and they get rehydrated, excuse me, those symptoms disappear. So knowing whether this is a reversible dementia or something that we need to check out, and how do you do that? I already talked about advocating and then coordinating the follow-up. That's the biggest thing. And you hear the hospitals complaining about this all the time. We send them home, we tell them that they're supposed to call their doctor, but you can't get an appointment within a week of getting out of the hospital. And then you've forgotten about it. So just because I'm trying to manage the caregivers coming in, et cetera. So that's part of our role. The financial piece, again, I don't need to know the details of your business or your financial affairs, but I need to be informed enough that I can also talk about price points. Can you access some of these other services out here that would be of benefit? Or should I be looking at programs that the county provides? Do you qualify for both Medicare and Medicaid? And again, even if you have all the money in the world, is it worthwhile to spend the money on this particular object or service? Not always. So helping talk through the pros and cons of the various things. And if lower cost alternatives are needed, helping to talk through those. In this area, we are blessed with a plethora of assisted livings and senior communities, but they're very expensive. And not everyone is right for every single person. The one down the street might not be the best fit for you. And I'm talking hypothetically. I know there's like 3 or 4 right around here, if not more. Again, knowing what types of housing options there are out there. What does it take to age in place? You can age in place in your own home and bring those assisted living services into your home, minus, of course, having a RN on duty 24/7. But you can bring caregiving services into your home. So is that the right option? Or is it a better idea to look at another community? There is independent living, and a lot of people think, well, as soon as I go into senior living, somebody's going to take care of me. In independent living, they might offer you a meal. They might have a social services coordinator who can help kind of point you out to some of the services that are out there. So, you know, part of the job of a care manager, but they aren't there to provide nursing support for you. We do see that every once in a while, that somebody will say, okay, well, I'm here in this continuing retirement community, like an Ingleside or a King Farm, and I'm in independent living. How come they're not giving me services? Well, you're not in the assisted living. Assisted living is when they do take care of your activities of daily living. So bathing and dressing. Memory care is assisted living, but it's set up for people with cognitive issues. And then of course, nursing care. And I would say most of us will probably need to spend some time in nursing care. That's also where you get your rehabilitation. So if you happen to need, this hip surgery that I'm anticipating, if I need rehab following that, it might be that I'm going into a skilled nursing facility. And of course, these days, it's really important to check out all of those because of what's happened during COVID. Legally, I know you all had in this series a discussion with the lawyers. Part of our role in that, not just connecting you with those individuals, but also helping you weigh the pros and cons. One of the questions I get asked quite frequently is, well, who do I choose as my power of attorney? Does it have to be my oldest child? Does it have to be my oldest girl child? But no, it doesn't. And in fact, I'm the oldest girl child. I'm the oldest daughter. I'm the care manager. And I told my parents, no, you want my sister to handle your finances because that's what she does. And you want my brother, who's a nurse, because that's what he does. And I'll just tell him what to do behind the scenes. So, that again, that may not be the right choice, but it also so happens that those two siblings of mine live closest to my mom. And then, of course, if somebody does need guardianship, then that we can get involved with advocating for that as well. Part of it is also supporting the family. One of the things that I talk to children about when they call is that their children are kind of like part of that stool that the older adult is sitting on. I need to support them just as much as I need to support the older adult. But families come with dynamics. It doesn't matter that I am in midlife. When I go home, I'm still that child. And there's just no way to get around it. It works better when we've had these conversations, much like your mother did. You can at least talk about it. My dad's family has 10 children in it. He was the second oldest. Oh my goodness. They all mean well. But it's really hard to put some of those feelings as siblings to the side and just focus on the older adult, whoever is in need. So finding support groups, helping monitor so that if, for example, you're in the area, you can also have time just to be that son or daughter. That's a big part of care management, is just helping put aside that responsibility for a minute. It's not, we don't make decisions as care managers. We make recommendations and then we help move this forward. But sometimes it does help because I can walk in and I can say something to an older adult and I'll have the son or the daughter behind them going, I just said those exact words to them last week. Why are they listening to you? Because I'm not right there. I'm not their child. I'm the professional who's come in and in giving them my recommendation from my experience. It's just the way it is. My parents did the same thing to me. So I don't take it personally. And I suggest you don't take it personally either. Knowing about the local resources. So one of the things that I think brings people to Seabury Care Management in particular, and I'm trying to keep this general, but we are a nonprofit. Our care managers tend to come from the local community, as in they used to work with Department of Aging and those type of places. So we do know about the area resources, but every care manager should know about the area resources. If the person's a veteran, helping to access any services through Veterans Affairs. Advocacy just across the spectrum is one of the things that we have to do. So maybe saying to a physician or saying to the client, I see they've just put you on this. Let's ask about this. Do they really need to put you on Haldol, or do they really need to put your mom on Haldol is what the conversation usually is. What are the pros and cons of those things? Do we really need to put this person with dementia through a colonoscopy? Is that of any benefit to them? What did they want in their advanced directives? And would that be following through with what they want? And is it just too much? I'm thinking of one particular client that we've had in the past. She actually has intellectual disabilities, but putting her through that is not the right choice for her. There's not going to be any treatment if there does happen to be something. So talking through those things with the client if appropriate, and definitely with the decision makers. Certainly in community living, once you move into a community, a lot is taken care of. We also see, though, there's benefit of just having somebody else helping to watch over. It's never bringing caregivers in isn't perfect. Moving to an assisted living isn't perfect. It takes a lot of flexibility. I would venture to say, even in your mother's situation, there are things that she'd like to change. I mean, there's things in my own house that I would like to change. Okay. I put crisis intervention last, even though it was on the 8 areas of knowledge first, just because I felt like this is kind of the summary. And again, this is where most people come in to service for us. It is about mobilizing that response because it isn't usually an immediate crisis that's happening. Sometimes just giving a person a little bit of space to be able to look at the broader options helps. There's also just getting those services into place. Sometimes the connections we have, just being able to call somebody and say, tell me who your best caregivers are. Not that they're available, but tell me what you can do for a person of this type of personality who has these needs. Helping give the decision makers a sense of what the options are really gives that kind of peace of mind. I tell my clients quite frequently, we make the best decision we can with the information we have today. And then if we need to readjust tomorrow, we're going to readjust. But I think part of it is just knowing that there's somebody else you can turn to when that happens. The same thing might happen to you when you're out there all by yourself, but it's nice to know that you also have somebody that you can turn to. And again, just being the boots on the ground, being the person when a child is out on a business trip or is in the middle of a meeting they can't get out of, and yet their mom's now in the hospital, having somebody who can go to the hospital. During the pandemic, we were making a lot of calls to the hospital. Some of the hospitals would let us in. So adjusting as future becomes present. That's where I think the grace really comes into navigating this, is having the flexibility to roll with some of these punches. You were saying earlier that life isn't for the faint of heart, or aging isn't for the faint of heart, I think you said. But being able to be flexible, and some of that comes from the planning ahead. I planned for this talk, and it didn't go the way that I thought it was going to go, or it didn't go the way that I thought it did when I was standing in front of my computer practicing, right? But I knew that that was going to happen. But I had the flexibility to roll with it. The resiliency, one of the big things that I see in my clients and their families is they have a lifetime of experiences. A lifetime of addressing things that have come up. So it's important to remember those strengths and move forward with that resiliency. I think a big piece of it is communication with your support team, with your providers who are out there. I think that makes it a lot easier, because if you're not asking the questions, you don't have any information to make those decisions. You asked about transportation, and I did not really address that. But that is one of the ways, one of the things that I often say, and in fact, I had in this talk and took it out. One of the things I think is really important is to consider what life would be like without a car. In fact, I have a plan for my little 8-year-old that we're going to learn how to take the bus somewhere, because he uses the bus for school, which is different. I did not. I went to a private school, so I didn't use the bus. So I'm about to teach him those life skills. And I hope that when he turns 50 or 60 or 70 or 80, that he'll still consider, you know, what are my options in this neighborhood? How can I access service without a car? Not just if you aren't able to drive anymore, but what if your car breaks down and you can't get that repair immediately? And again, I'm making this general because all of these things that we have to plan as we get older, we've had to do the whole time. You know, we have to figure out the housing situation when we're young and single, and then when we're married and our family maybe increases or doesn't increase, and then as we get older. So these are all things we've had to deal with in the past. It's just that we put a new lens on it. Does that make sense? These things that we learn, we're still using them. It doesn't matter. It's, what did you learn in kindergarten? That phrase that was big when I was in high school. Any questions?
Okay. If you can, this is the portable mic isn't working. Can't get better.
Oh, no.
Christine, thank you for your presentation. It's super helpful. What I heard a lot of how we can approach a situation when there's acceptance and active participation. Do you have any thoughts on where there's maybe not active participation either on the child end or the parent end? There's maybe a refusal to acknowledge that things have changed or are changing, and how might you approach things like taking car keys away or needing to move out of a house when that willingness isn't there?
Mm-hmm. Yeah, and I would, you know, part of the reason why I didn't address this was it was about planning ahead and aging gracefully. But I would say many of our clients are in denial about where they are, or there's an issue, a disagreement within family about where people should be heading. And it really depends upon the situation and what's going on. For example, we have a client who has dementia. She was still driving. I would say a lot of older adults actually restrict themselves. They stop driving at night. They start driving around the block so that they don't have to take left turns anymore. I myself, you know, the 2 accidents I've had in my life have happened at the same entrance to the highway. I do not use that entrance to the highway anymore. So we all do it. So part of it is kind of taking a step back and seeing where the person has already restricted themselves, making it less of a need for them to have to drive anymore is usually very helpful. So either if you're not in the area, finding a service or finding somebody who can drive them. Sometimes it might be giving little white lies about, no, mom, nobody's paying for this. The county just offers it. Or something like that. And then when the opportunity presents, I think is the best time to do that. So for example, with that client that I was talking about, who she was really safe, just driving about a mile from her house, but the most accidents happen within a mile of your house. Her car needed to be re-registered, and we just forgot. She's under guardianship, so the guardian was okay with that, but we just forgot, and we kept telling her, oh yeah, well, we'll do it. And eventually dementia, she no longer drives anymore, and she's fine with it. I believe the car is still in her garage. But it is kind of navigating what is best for that person with regards to driving. I also had another client that, with my previous job, that one of the social workers in the county actually went and undid something in the engine. But and again, this was somebody with dementia. She was cognitive enough that she had no idea what was wrong with her car, but she knew who to call. So, so then it was also a matter of having to call the car person and say, don't fix that car. But again, those are extreme cases. I think some of it is continuing those conversations. Part of with the bigger picture and not with the driving, what we try to do with our clients, I would say, is we try to put what services we can in place, or at least get things ready for that opportunity. So what I say is we're kind of laying out the mattresses and trying to cushion what we see coming down the road. But it's really hard when it's your parent that you're talking about, because you feel like you shouldn't be sitting on your hands. And I would say you're not sitting on your hands. What you're doing is you're educating yourself. You're continuing to try to have those conversations. Maybe you've brought in the professional to also see if that helps. I told you the lovely story about somebody who I'm looking at you just because you're right in front of me. Somebody was standing right behind her. And they were saying, I just said that to them last week. That's not always how it works. My clients also tell me, yeah, Christine, that sounds nice. We're moving on now. But it is about educating yourself, continuing to open up those conversations, and starting to put things into place so that it isn't so much of a, oh my gosh, now mom has to go home tomorrow and we don't have any services in place. It's, oh my gosh, mom has to go home tomorrow, but we've done some of our research. Here's where we can reach out to. Yes, ma'am. So the guardians, yes, thank you for reminding me. She asked what my knowledge about the guardians and where they're from, and with people who don't have any personal representatives, what's happening to them. I guess there's a couple of different levels. We do have people who come to us when they are fine, they can make their own decisions, but they don't have a power of attorney. They don't have family. They don't have a friend that they feel like they can turn to. So part of it is trying to weed out, okay, is that really the truth, or is there somebody who could act as power of attorney for you? And if there's not, are you financially able to pay someone, an attorney, usually an elder law attorney, to be a power of attorney for you? When somebody gets to guardianship, that means they no longer can make those decisions on their own. And again, this is either for healthcare or finances. And there is a spectrum, because one of the things we often look at is supportive decision making. I believe that even if you have dementia and cognitive issues, you can still inform us as to the decision you want to have made. So I need to respect that. Even if I can't ask you directly, do you want to move? I can talk to you about the situation you like to be in, why you wanted to stay in your own home, all of these things to kind of inform me to be able to say to the guardian, yes, this is an appropriate place for them. I know we have to move them, so this kind of fits what I've heard or the relationship that I know about them. So it can be a spectrum of how somebody can contribute. But with regards to guardianship, I would say typically, especially here in Montgomery County, there in every county, the lawyers, they are elder law attorneys who have decided they want to be guardians, which means they make the decisions on behalf of their clients. The courts are the ones who assign the guardian. Again, it's frequently an attorney, and the purpose for that, and I should say that every court and every county social worker wants a family member or someone else to be involved. They don't want an attorney involved. They would rather have a family member. But the filings that you have to do with the court are quite extensive and are practically a full-time job in and of itself. So I have seen plenty of family members who were assigned as guardians by the court, and Montgomery County doesn't play. If you don't get your paperwork in, they're just going to turn it over to an attorney. That's the end of it. They don't play because this is somebody's finances that are at risk. Now, on the opposite side, on healthcare, that in Montgomery County tends to be a county social worker who's been assigned, if it's not a family member who's being assigned, or usually family member. It's usually a county social worker who has been assigned. Montgomery County typically does not like to assign guardians of person, again, because with your healthcare decisions, you can make decisions for a lot longer than you can tend to manage your finances. It's that just the different challenges it takes. I can tell you that I want to have a flu shot, but I can't get my checkbook up to par to save my life. So they tend not to assign a guardian of person until closer to the end of life. So looks like I answered that question. We not a lot, but we do have probably about 20 or 30%.
I've been involved with assisting a parishioner who's gone from independent to independent living and to assisted living in 10 months. Is this right? Can you hear me? Is this helping? Really? Okay. I practically have to be eating this now. It's like an ice cream cone. The issues that we've run into have been, you're dealing with the minutia of a person's lives that you just don't assume it's the case. So you had some discussion about financial issues. So one of the issues is that when she moved into the retiree home, senior living home, she paid a deposit for months in advance. And then we discovered last week that that was the last payment that she had made. And she was way behind on her monthly payment for her room and care. I had thought that she had signed something that allowed for automatic withdrawal. So we're curing that right now. But we had other issues. She had collected checks. Some people still send checks and she couldn't deposit them. And they were nearly a year old. So I had to run down and she handed them to me. We talked with the bank and we managed to get it in before they all had to be withdrawn. And they were a lot of money. We discovered that in the change of address, that many bills were delayed getting to her, and the ones that arrived, when I finally saw them, many of them were overdue. So issues are automatic withdrawal is a good idea for some things, but she had set it up for Pepco. She's no longer a Pepco customer. She's now been paying for 4 months, and they won't accept anyone's word but her to cancel. So we're wrestling with that issue. Checks arrive. Mail is slow getting to her. Payments sometimes are made, sometimes not. So what I'm suggesting to everyone, if you're ever in this situation, give some attention to the details, see what's being billed, and see if it can be stopped if it's no longer appropriate. If she's getting checks, make sure they're deposited. If there are things that you know are recurring, put it under automatic withdrawal. And the same thing with deposits. These things catch you unawares, and they are difficult to unravel when they've started to unravel. So be aware of the minutia. It won't be a minutia for very long.
Yeah, no, that's exactly. We spend a lot of time looking through the minutia. There are such a thing as, or a service out there that's called a daily money manager, which is very helpful to kind of help people do their budgets and their daily.
I should have said that. On Thursday, I'm bringing the new daily money manager and his assistant to meet with my friend of 50 years so that they can take over watching the documents, visiting her periodically, making things don't happen. But until that happened, it was all volunteer and haphazard, and it really was quite a problem, but we're going that direction.
Yep. Yeah, and thank you to all the volunteers out there. I know the other big thing in this area is the village movement. The Capitol Hill Village was the second village in the nation, and now we have many, many villages in this area. And as they say, if you've met one village, you've met one village. So a village is a neighborhood that has come together and decided they want to support people to age in place for as long as possible. There's a social aspect to it. So, you know, about either getting speakers in or having Sunday dinners, or much like you might have at a church as well, but not everyone is involved in a church. And then there's a service side of it where the neighborhood also volunteers to volunteer with their neighbors. So it might be taking them to doctor's appointments. It might be just doing friendly visits, making sure they get to those social outings. They're really great. There's usually many of them are volunteer driven, but there is a membership fee so that they can pay. There's usually about 2 staff people involved, and then a board that runs it. So they're very helpful. Mm-hmm.
We're talking about putting people in place for these different services. And my understanding is, I'd like you to just delve into that just a little bit. I find that to be it's a statement that actually is like dissertation that is involved in actually making that happen. Am I correct that Seabury itself has recommendations they could make to a family of where to start? These are people we've used. These are organizations that we feel are trusted, but you don't personally, Seabury, have healthcare workers or people who count as that type of service, right? For example, my parents need trusted individuals for transportation to be able to access some of the things that make their life more fulfilled, that add to their quality of life. But you don't necessarily always have those services. Eventually, they're going to need somebody who might be there to help them with the shower, who might be there to help them with some of those other, if they age in place. But that's also something that you don't personally have. Is that correct? You say a little bit about how to find that needle in a haystack.
Yes. Yeah. So at Seabury Care Management, we have care managers who do the work that I've talked about. We're all licensed social workers, master's level. We also have what's called a life enrichment specialist. These are concierge companions, so they don't provide personal care. They provide more of that quality of life aspect. So maybe a person who can help drive someone to a doctor's appointment, someone who can provide a weekly socialization, something that I would like to get to in my work, but I'm usually so busy with the medical piece, so busy putting some of those other pieces in place. And most people just don't want to pay me for that. So at a lesser rate, we have a life enrichment specialist. They are not a certified nursing assistant who will come in and provide something like the bathing and the dressing and the care that someone needs. But what our role is, again, to know who those trusted individuals are. So part of my role and Jennifer Brown's role is to get out to these senior networking meetings so we know who are the latest companies out there, what's the latest invention in this area, who's the entrepreneur who's figured out something new. And then with our clients, we work with places like home care companies. Again, it might be a company that accepts Medicare following a hospital stay, but more than likely, we're really talking about the private pay because Medicare will only pay for a very short time limited after a 3-day hospital stay or rehab stay. I'm going to get to you in just a minute. It's also about knowing the daily money managers and the elder law attorneys. Again, in this area, we are blessed to have anything that you can think of. Is it always appropriate? Can people always afford it? No. So that's part of our role. Then our role is, again, if somebody's just consulting with us, it is about just giving you the names and phone numbers and saying, talk to this person, tell them I told you to call. If I'm the person who's doing the care management though, then I'm probably making that phone call. You're making the decision, you're signing on the dotted line for that service. But I'm coming in to say, okay, I'm going to help interview these caregivers with you. I'm going to be there on the first day that the caregiver comes in and try to help translate. This is what's needed. Here's how we do it. Or maybe I'm using one of our life enrichment specialists to do part of that piece. Does that help a little bit? Okay. Yes, sir. We have, let me see, we have 13 people on our team. Of those, I'm doing a rough count in my mind, 9 of them are care managers. That also includes myself and Monica Miklos, our director. Monica and I tend to just carry a small caseload because we're trying, or for myself, I tend to do the consultations or the one-time roadmaps that we have. So that we can help run the organization so the board is happy with it.
So we decided for this forum, we wanted to wrap this one up a little early in case anybody wanted to have an individual question after we close down Zoom, because Zoom is a recorded session and some people may want to ask a question that's not recorded. So are there one more question? If not, shall we thank? Yeah, go ahead. Yes.
Among the people that you have
Yeah. Yeah, so I mean, geriatricians are doctors who specialize in working with older adults. We do tend to recommend that people work with geriatricians. There are not enough geriatricians in the area. And the other thing that I frequently find is my clients like to stay with the doctor that they've been with for many, many years. So while it might be something that we recommend, I'm not going to knock these things out just because I think they're better. You know you. So yes, we do. And I can certainly give you, if you all have questions about specific resources and would like some names, I'm happy. My business card is on the back corner over there. And you can certainly shoot me an email or talk to me afterwards. Because there are, the other thing is there are now geriatricians who will come out and visit the older adult in the home, which is wonderful. There's also concierge physicians, which tend to be a little bit more expensive. Some of them don't take insurance. You have to be the person who sends it to Medicare or your insurance provider. And again, that's something a care manager might help out with. But there's a lot of options out there.
Okay, thank you. Brilliant.
Yeah, so part of the thing with a care manager that makes it different than working with a caseworker with the community is that we do cross jurisdictions, so that continuum of care is still there. And we do see clients in Virginia, Montgomery County, Prince George's County, and then throughout DC. The other thing is that if you have a caseworker with the county, it tends to be short-term kind of crisis involvement. Then they have to close the case and you reopen if something comes up. And if you move across the area, let's say you end up having to, well, if you happen to move into a senior living community, they usually stop right there anyways. But we have had clients who have had to move into a place across the border, so to speak. So we'll still follow you into different communities, housing settings and states. But I won't go all the way to California. Sorry.
All right, so before we wrap up, I just wanted to say, if there's anyone here who doesn't get my emails, if you're maybe under the age of 65 and you'd like to receive some follow-up resources, please come and give me your email. And thank you so much to Earl and Kathy, who actually started this whole idea, this initiative. Fantastic, thank you so much. And to Sarah and to Suzanne, we had a lot of meetings, the 5 of us, to put all of this together. Thank you so much. And I'm going to be sending an email with all of the follow-up resources. And for today, thank you to Seabury, to Christine, and to Beth. So have a great rest of your week.